evening, you're watching News Mongolia on MNB World. I'm your host, Saltan Hortz. For our top stories, COVID-19, 1,098 new cases reported on Tuesday. State's tally is now 32,437. UK variant detected by preliminary lab test in Mongolia. Doctors are overloaded by rising COVID-19 cases. For other news, stay tuned. The Ministry of Health reported 1,098 new coronavirus cases on Tuesday. Most of them were recorded in Ulaanbaatar, with 957 cases. Currently, Mongolia is under the strictest state level of emergency. In the last 24 hours, around 10,500 people were tested for COVID-19 and 1,098 new cases were confirmed. That increases the state tally to 32,437 coronavirus cases. Also on Tuesday, 8 fatalities was recorded, which is another high number so far. The patients who perished were between 51 and 78 years old. The recovery rate for Mongolia is 54%, and 58% of the current hospital patients are displaying mild symptoms with a dry cough, fever, and fatigue. The vaccination rollout is ongoing according to the graphics. Starting from today, people aged above 45 are getting their first shot of the vaccine. According to the Worldometer reference website, global coronavirus cases are now at 147 million. The total number of confirmed deaths is over 3 million. The country with the highest number of COVID-19 cases is the US with 33 million, followed by India with 18 million. Currently, India is experiencing a deadly second wave. World countries are expressing their solidarity and making plans to send aid to India. On Friday, the National Emergency Commission reported that a new variant of COVID-19 in Mongolia was detected in a preliminary lab test. The new variant is likely to be the UK variant. Infection was confirmed in 3 passengers on a flight that recently arrived from Turkey. The UK COVID-19 variant was first confirmed in UK in September 2020. As of April 2021, more than 50 countries have reported cases of the UK variant, which some researchers believe has a significantly higher risk of fatality. On Friday, the National Emergency Commission announced the preliminary lab test confirmation of the COVID-19 variant, which is thought to be the one that first emerged in the UK. It was detected in the testing of 3 passengers on a charter flight from Turkey. 2 more variant cases were confirmed in testing in Ulaanbaatar with unclear origin. Research is currently ongoing to confirm whether or not Mongolia has been affected by widespread transmission of the UK variant. Scientists say the UK COVID-19 mutation is highly infectious. The main symptoms include diarrhea and vomiting.
The scientific name of the UK variant is lineage B117. International data shows that the UK variant spreads up to 80% faster than the original variant. Currently, the USA and European countries have reported high spread of this variant.
There are 4 COVID-19 strains commonly known. The UK variant has been identified in more than 50 countries. The South African variant has been detected in over 20 countries. The latest variant discovered is the Indian variant. It was first found in India and later in other countries around the world. The general sign of the emergence of new variants is a sudden upward swing in the number of infections. On Monday, April 26th, Prime Minister Oyun held an official meeting with the ambassador of India to Mongolia, Mr. Singh. The 2 countries discussed their joint efforts to overcome the pandemic. The Mongolian government expressed its solidarity with India for overcoming this hard time. During the meeting, the Prime Minister expressed his concern about the critical pandemic situation in India, as well as for the many lives lost. He noted that Mongolia is supporting India and handed over a letter written to the Prime Minister of India, Narendra Modi. Prime Minister Oyun also expressed his gratitude towards the Indian government for delivering the first 150,000 doses of COVID-19 vaccines to Mongolia by means of a grant. He also noted that the Aid for India movement has already underway among the public. Through this meeting, Mongolia showed its warm support to India and marked the two countries' harmonious relationship in past 66 years. Indian Ambassador Mr. Singh thanked the Mongolian government and appreciated the efforts of Mongolians who are standing with India during this struggle. The two sides agreed upon proceeding with the projects implemented within the strategic partnership, including the building of an oil refinery and the transportation of coal. Thank you for staying with us on MNB World. Now let's take a look at Mongolia's current affairs. The Prime Minister of Mongolia, Oyun organized a meeting with the Russian ambassador, Mr. Azizov. The Prime Minister pointed out the importance of clarifying the schedule of vaccine supplies and speeding up the process based on the agreement to purchase 1 million doses of the Sputnik V vaccine from Russia. The ambassador emphasized the need to intensify the supply of vaccines and said that with the start of the fourth wave of the pandemic in Asia, the government of Mongolia is responding well to the pandemic. The Prime Minister and the ambassador also emphasized the need to develop a detailed action plan for the 100th anniversary of the establishment of diplomatic relationship between the two countries. The parties agreed to pay attention to planning high-level visits and meetings in this context, according to the government's Media Relations Department. The National Center for Communicable Diseases has been building a new oxygen plant. Now the construction work of the factory has finished, and officials said they are testing the factory's operation this week. The plant was built due to the high demand of oxygen needed for coronavirus patients. Currently, oxygen demand has increased fivefold as the coronavirus infection is surging. Previously, the Oxygen Transfer Center produced 100 cylinders of oxygen daily, which is a total of 600 cubic meters. Now the new plant, built with German technology, will produce 40 cubic meters of low-pressure oxygen per hour. Also, it's highly capable to charge 3 to 4 high-pressure cylinders in an hour. With the new plant, the oxygen will be delivered to intensive care units through an underground network and through a wall connection. Now let's take a look at the currency exchange rates provided by Mongol Bank. As many as 2,000 COVID-19 patients may be treated by only one physician and one nurse. With COVID-19 cases growing in number, other hospital services are taking a backseat to care for COVID-19 patients. The Ministry of Health reported that they are working on stabilizing the workload of medical personnel. Due to the sharp increase in the number of COVID-19 infections, the lack of access to healthcare in the community is being discussed on social media and in the press. To address this issue, officials have been doing on-site visits to assess the situation. To date, around 12,000 people are under medical observation, with about 7,000 being isolated at home and 4,000 in hospitals. Doctors are deciding on whether another 2,000 patients require hospital treatment or at-home supervision. Representatives from the Ministry of Health and the World Health Organization visited district emergency headquarters, general hospitals, and family clinics to discuss these issues. Currently, we lack people who are able to transfer COVID-19 patients with severe symptoms. We are asking our neighboring districts to take our patients.
Let me explain the situation with a specific example. Yesterday, we received one COVID-19 patient with mild symptoms that we witnessed get worse. In the morning, the symptoms became severe. We are still talking about the same patient. I would like to mention that this patient tested positive for COVID-19 3 days before coming to the hospital, but due to the lack of beds, the patient couldn't get the treatment they needed.
We worked together, we identified, we understood that there is still challenges there is still need for training, better training of the response team. Also, we need to found that there is need for better coordination, especially in monitoring of the bed occupancy to ensure equal distribution when people are needed in every hospital where they have still beds. Apart from this, I'm very happy to know that from today we are resuming our vaccination program, which we will give or start to vaccinate those who didn't receive still first dose, but also giving the second dose for the people who received. But again, we will prioritize at first health workers with this.
It all comes from people's attitudes. Once someone is diagnosed as positive for COVID-19, they automatically think that they are supposed to be in the hospital. This attitude has also become a problem for our work. We are experiencing a major lack of medical personnel because all of them are divided into groups and each of them is responsible for certain work, such as administering tests and examinations for patients who are receiving treatment at home, and so on. That's why it now seems like only one doctor and one nurse is working on 1,500 to 2,000 COVID-19 patients. State officials discussed the problems encountered and resolved some of them on site. To balance workloads, 648 resident physicians were mobilized last week, and more than 350 beds have been added to hospitals treating COVID-19 patients. A working group at the Ministry of Health said that they are studying resources to prepare 300 beds for a general clinic in Bayosho and 50 beds in Bayinzurh district. The ministry also reported that the World Health Organization is providing hospitals with essential equipment, such as oxygen respirators, rapid diagnostic equipment, and telemedicine resources. Mongolia's Dana Batgiril, also known as Storm, got it done with the first round TKO on Saturday night after a rocky start to the UFC careers of the 3 China Academy graduates on show in Jacksonville, Florida. Bantamweight Batgiril stopped Kevin Natividad after just 50 seconds in the 4th bout of the UFC 261 prelims, following losses for the debuting Na Lian, Aorichi Leng, and Ron Zhu. The 31-year-old Batgiril threw a front kick up the middle, switched stances, then landed a spectacular check left hook as Natividad was rushing towards him. He followed up on the ground with a few shots, and referee Herb Dean was quick to step in. It was the second win in 3 UFC appearances for Batgiril, who lost a decision on debut to the China Academy's first graduate, Alateng Haley. Now let's take a look at the weather forecast for the world's major cities. This is it for today. Thank you for staying with us. We'll see you tomorrow with more news and updates. Have a nice evening. Goodbye.